everybody. How y'all doing? How you doing? Welcome to Jarrett Talk Interviews. As I interview people that have their own YouTube channel or a business. Today, I have a very special guest. I know this person a long time, way back. I have to go back way back. Here's my hygienist. I go there every 6 months, and she great at it. And I was while I was at her, I get my teeth cleaned, my brain's going off, and let me get an interview with her. And she accepted my invitation. How you doing today?
I am doing great, Jared. I really appreciate you inviting me on your show.
So please tell the people that do not know about you how you start how you start your business. I mean, how you became a dentist, a dental hygienist.
Well, I've been practicing dental hygiene for about 25 years. Initially, I actually thought that I wanted to be a pharmacist. And so I took pre pharmacy at Mercer University in Macon. And then after I took organic chemistry, it changed my mind. And so I knew that I loved science and I loved working with people. And so I did some research and decided to pursue dental hygiene. Yes.
Were you kind of nervous when you started that field, the medical field?
Yes, because when we first started seeing patients, they started off with very easy cases. And then as it progressed, there were more advanced cases. And I was like, I don't know about this. But in the end, I'm glad I chose this path. I'm able to work with people, and a lot of people have fears when it comes to the dentist,
Mhm.
and so I have learned to help people with that fear.
What was do you remember your very first patient when you started?
Yes, I do actually. I remember my first patient, and I was very nervous,
Mhm.
and I forgot to floss her teeth, and she was very understanding, and after that, it just it just got easier and easier.
What was Dr. Stein was there helping you out when you started, or were you there like was it all women, or was Dr. Stein there before y'all came
So actually, when you're in dental hygiene school, you see patients, and so
Mhm.
that kind of prepares you for the real world.
Mhm.
I did start at a practice in Augusta, Georgia. That's I'm from Harlem, Georgia, which is near Augusta, and I
Okay.
attended the Medical College of Georgia, the
Mhm.
dental school there. And then my first job was in Augusta, and then my heart was in Atlanta because and I felt like Augusta was just too small for me. And
Okay.
so I moved to Atlanta, and I've
Mhm.
been here ever since. 25 years ago, I moved to Atlanta. I temped around a little bit, and then I found the office at Family Dentistry in Decatur, which is a wonderful practice. We're like family. Dr. Stein has retired, but I'm working with Dr. Frankel and Dr. Suzanne Silverman. Um, and it's just a great practice.
What did Dr. Franco taught you when you start doing people?
But Dr. Frankel, he allows you to be yourself. We try to keep up with Dr. Frankel. He is just amazing, and he can. I don't know how he's my role model in the fact that he can, listen to the patient. He has that empathy for the patient, and he reassures the patient. And I learned that as well. And the most important thing I believe is listening to the patient and reading their body language, because like I said before, a lot of people when they come to the dentist, there are some fears. Now, some people, not everyone is that way. A lot of people love the dentist, but a majority of people they have fears. Even from I had one patient who told me the smell of the office. You smell all the dental, I guess, smells
Okay.
of a dental office. Um, and the sharp instruments that we use.
Yeah.
Um, but it's important to go to the dentist, especially for your cleanings, because oral health is so important. Um,
Mm.
if you have an infection in your mouth, it's not good. It can affect other parts of your body. So it's important, like you said before, how you come to the dentist every 6 months, twice a year. At least, you can come in for x-rays and an exam so that we can get a treatment plan to see what you need. Yes.
So when you get done, with your work, everything, do you ever go home? I mean, when you get home and you ever think about, do you ever talk to yourself like how I did today? Do you ever like encourage yourself how like I may have did a good job? Do you ever like encourage yourself when you got home and think about what you did today and like
You know, Sorry to interrupt, but yes, Jared, my mantra is to treat others the way I want to be treated. And I made a decision years ago to enjoy my job, because if you don't like your job, then it's just going to be terrible.
Mhm.
So my mantra is to treat people the way I want to be treated, treat you like family. And so when I go home, I sleep well at night,
Mhm.
but it can be exhausting because, again, you're dealing with patients who have that anxiety, and you know, you're trying to reassure that.
Okay, so what kind of bad did um the dentist, I mean the doctor, the one who got retired, what kind of advice did gave you before you like Franco took over? What kind of advice did he gave you before he took over?
Um, they, Dr. Stein would allow me to suggest things. He would help me with reading my x-rays.
Hmm.
He and Dr. Franco actually started the practice together. But Dr. Stein has retired now, and Dr. Frankel is there. Um, but yeah, he would allow me to review the x-rays, review cases, review treatment plans, and that really helped build my confidence. Because a lot of it, when you're in any profession, you have to build your confidence, because when you're first out of school, you're nervous, you're wondering if the patient's going to like you, if you're flossing too hard, if the water's too cold on their teeth. It's just all these factors that you have to keep in mind. You have patients where they can't lean all the way back, and your back is in an awkward position, or you're in an awkward position. So yeah.
So what do you ever get frustrated few on in those days when the patient don't get like you said don't like sit back and what it's supposed to? Do you ever get frustrated sometimes at work?
To be honest, yes. I think with any job you kind of get frustrated, but I have to check myself. And the good thing is I'm around coworkers who check me too, and so
Hmm.
we check each other. And you do get frustrated sometimes, but overall, it's a good experience, and I'm glad that I went into this profession, because I there are things that I know now that I didn't know before hygiene school. I didn't know that I was supposed to like brush twice a day, floss every day. There are a lot of things I didn't know that bacteria can transfer to other parts of your body, like your heart. And if you have a knee replacement, you need to take antibiotics. Everything is connected. So yeah, I learned a lot.
If you want being a dental hygienist, what will you be doing?
Oh, I like to travel. Now, 25 years ago, I was, like I said, I thought about being a pharmacist, but I'm glad I didn't do that. I'm glad organic chemistry kicked my butt, because when I look at pharmacists now, they're working hard. No, no, no offense. I respect the pharmacists,
Mm,
but they work hard. They're dealing with sick people a lot,
mm,
and I'm just glad I didn't pursue that career. But I
mm.
love to travel. That's a good question. If I could do something, maybe when I retire, do a job where I would travel a lot. Oh, I would love that.
So wait, so what day do you what day do you come to work and then and do you work every day or you just do they put do you have a schedule out for y'all whatever day they come when they come to your work come to work.
I work Monday through Friday, and the beauty of the dental hygienist position is that you can customize your schedule or you there's some hygienists who work 2 days a week. There's some who work 3 days a week. I work 4 days a week, and I'm off on the. I mean, I'm sorry, 5 days a week, and I'm off on the weekend. Um, the hours are pretty good. The first patient is at 7:30,
Mm-hmm,
and our day usually ends around 4:30. But
mm-hmm.
everyone's schedule is kind of customized to them. If you need a break here and there, you can take it, and that's the beauty of where I work at. That it's very flexible and
Mm-hmm.
understanding and family oriented. A lot of us started off with no kids, and now we have big families, and you know, it's just our practice is very family oriented and understanding in that aspect. So we support each other with that.
So you've been there who been there the longest? Like I tried
Ooh,
the whole business. Who been there the longest?
that's a good question. As far as the hygienist, um, there's someone who's been there, Miss Giza. She's been there, I think, the longest.
Mm-hmm.
I call her Jersey because she's from New Jersey. Um, of course, Dr. Frankel's there, and Dr. Silverman. She's a dentist who's been practicing as long as Dr. Frankel. She actually attended the same school. Dr. Frankel attended the same school that I attended.
Okay.
As far as the assistants, I would say there is. I'm not sure about the assistants who's been practicing the longest. That's a good question. I think I would say Mrs. Foster. She's been practicing a long time. But even our new assistants, even though they're new to the game, we they one assistant she picked up so quickly because of her. She just picked up quickly and she learns quickly. And so, yeah, that's a good question. But I would say, as far as the hygienist, Jersey, she's been there the longest. I don't. Yeah.
Okay. So you ever so if the new people coming there, do y'all ever help them how to do the right how to floss? I mean, do the nice thing. You know what I'm talking about scrapping your
The
teeth
cleaning
now.
and scaling,
Yeah.
yeah. They're trained in school. What we help them with is the program. Each dental office has a different dental software,
Mm-hmm.
and so there's a learning curve with that. So when the hygienist comes in, it's more so okay, showing them how the X-rays are taken because each office has a different program. I don't know if you remember back in the day, X-rays were taken with film.
Mm-hmm.
Um, and I don't miss that because with the film, oh, it was the cardboard. And then we would take the x-ray and have to develop it and process it. I don't know, this might be before
Oh,
your
I know
time,
you're talking about.
Jarrett.
Okay, I know you're
You
talking
remember
about
that?
the old. You might get somebody go to the dark room, putting the picture, like turn the pictures in the. Okay, I know you're talking about. Yeah,
Yes. So
yeah, I
you
know you're
don't know
talking.
about that.
Oh, yeah, I know
Now
you're talking
it's
about. Yeah,
digital.
yeah,
It's instant.
yeah. Uh, yeah, that that pain in the behind, but um, do you?
So
I'm honestly going. I'm not gonna put you on the hot seat. I know these ladies are in here listening to it. I might put all y'all on the. Do y'all love your job? I won't put it. Do y'all love your job? Honestly, be honest. All y'all together. Do y'all love your job? Honestly, if you do, let me know. Cause I want to know. Cause I know y'all have fun. I know y'all have fun. But seriously, do y'all really love your job?
I think it depends on the person. I love my job. I really do. Now I don't know. Yes, I love my job. It depends on I think the person. I think most of us at our practice love our job,
Mm-hmm.
but what you don't sometimes I tell people there, you know how they have these reality TV shows for different places. They need to bring one into the dental office because boy, we get some funny stuff going on in the dental practice. As far as the patients are can be very hilarious and entertaining. and we have this question we'll ask: is it a full moon? Because sometimes we can definitely tell when it's a full moon on 2450 Lawrenceville Highway.
Mm-hmm.
Okay, because the patients, I guess, like in any other situation at any other job, things are strange.
So, um, I know I'm there like every 6 months, but
Mhm.
honestly, I love coming there and basically always be there trying to keep my teeth clean. And matter of fact, since I'm here, how my teeth?
Have you been flossing? It look good. Listen,
See,
Jared,
there you go. I'm trying to
we
say.
got listen. That
But
we
yeah.
have this saying: floss the ones you want to keep. A lot of people don't floss, but they have other things, like the water pig, the water
Mm-hmm.
flosser, the little floss pigs.
Mm-hmm.
But that's the main thing, is trying to convince patients to floss. People are pretty good about the brushing twice a
Mm-hmm.
day,
Right.
2 minutes, no cheating, 2 minutes, 2 full minutes.
Mm-hmm.
Um, but for some reason, we can't get y'all to floss.
I know that I know that part, but how come some people you always ask people to brush their tongue? I know people don't want to do it. I know I'm one, of 'em, but what's the reason why you have to brush your tongue? Like what purpose of brush your whole tongue? Why you brush your teeth?
That's a good question, Jared. Your tongue holds bacteria on it. And also, it can get stained. So sometimes when you drink coffee or tea or even some medicines can
Mm-hmm.
cause staining on your tongue. And everyone's tongue looks different.
Mm-hmm.
Some people's tongues are smooth looking, and some people's tongues have grooves in them. And when you have deep grooves in your tongue, it's important to brush your tongue so that you won't have stinky breath, and that when you smile or stick your tongue out, it doesn't look crazy and have all these different colors like brown, black, red. People are like, what's going on with their tongue? So it's important to brush your tongue. That's a great question.
Have you seen your patients like that?
Oh, yes. And some patients, they don't like to brush their tongue because it makes them gag when they use a toothbrush.
Mm-hmm.
So they do have tongue scrapers at the stores you can buy, that helps, you scrape your tongue. But you
Mm-hmm.
don't have to go too far back. Just do the best you can, But you want to brush your tongue every time you brush your teeth because it holds bacteria.
So I know my mom telling me this. I know I have to brush my teeth twice a day. I know it's like 3 times a day. I know it's like I had to brush my teeth before breakfast, after breakfast, before lunch, after lunch. It before dinner, after dinner. It's like that's too much time. That's why I'm just being I'm being real with you. I know you gotta brush your teeth every day. For me, I just do it like twice a day. So I hardly eat dinner. So I just like drink water and just gargle with it. It's like, did that help? Sometimes if I don't brush my teeth at night.
Well, a lot of people will say, I don't eat. Should I brush my teeth? Yes, you should, because whether you eat or not, your mouth naturally forms bacteria in it. So you want to brush before bed because all that bacteria from the day, you need to get that off. And then in the morning, you still need to brush, number one, to freshen your breath, but also because while you're sleeping, the bacteria naturally forms in your mouth.
Oh,
It,
okay,
yeah.
okay.
So whether you eat dinner or not, it's just good to brush at night and in the morning. Of course, if you have some onions at lunch, it's probably a good idea to brush then too,
Hmm.
or garlic. And then if you're gonna floss, flossing is just once a day. So floss at night if you can. And for people who have dexterity issues where they may have arthritis or they can't maneuver the floss, you can use water picks, which is great. We love the water pick at our office. And you can also use floss picks. But ideally, you want to floss, even if you're using a water pick, you want to try to floss, unless you have problems where you can't bend your hands, you know, and it's the next best thing. Um,
even though we got if you can't reach in the back, like my mouth not wind up to put the pick back there. I'm have to have to ask my mom to put the pick in there. So how often do you have to how often do you have to floss? Like twice a day or 3 times a week or what?
we recommend flossing at night or once a day. Once a day. Um, some people need to do it more. So the goal is to not your gums for your gums not to bleed. So when you don't brush or floss like you should, your gums will be bleed because they're not healthy. Once you start brushing and flossing, that should go away. But for some people, flossing once a day is what's recommended. But we have some patients that have spaces in their teeth, and they need to do it more than once. But once a day is what we recommend.
What the I know what the hard what is the hard thing in being a hygienist? What the hard thing being one?
That's a good question. Let me think about that. The hardest thing, you know what? Over time, it can take a toll on your body because you're in a position where you're bent over. And so it can, in dentistry, it's known that we have back issues or neck issues because we're always bending over. Um, we are high risk for certain because we're dealing in your mouth. So it's important that we wear masks and glasses to protect our eyes, and we
Mhm,
have on our special jackets to keep the bacteria off of us.
mhm.
So it is a high risk job because we're dealing with bacteria. So that's another thing, especially during COVID. It was we really had to protect ourselves. So there was a lot of anxiety with hygienists during that COVID
Mhm.
epidemic. Yes.
So that's why you have to be completely safe with all that stuff on and make sure nothing, like spray in the office or anything and try to get sick.
Yes. Yes.
Okay, so what the pros and cons being a hygienist?
The pros is I like meeting all different types of people and learning things from different patients because when you start talking to patients, they may say they travel somewhere and you're like, oh, great, where did you travel to? So you learn
Mhm,
a lot from the patients. You meet people. I love the camaraderie of the team. Like I said, it's a big family. Some of the cons would be, like I said, the physical part of it, the risk of being exposed to, infectious diseases.
mhm,
Um, Also dealing the fears of the patient because sometimes when a patient is afraid it may come off the wrong way inside they're afraid, but to us the patient may be quiet. Some of them may be mean to you, and it's not because most of the time it's not because that's how they are, it's just because they're having that fear and anxiety setting in. And I noticed with a lot of those patients when we're finished they're a different person. So that's a challenge with dealing with the different personalities of people. And also you got sharp instruments. So you're trying to get them clean within a certain amount of time without hurting them. And you got to find that balance. And sometimes, if it's running late, you got a lot to do in a short period of time. But it all works out in the end.
So when you get to work, and set everything up, do you ever like sit down and like do you sit in your office and talk to yourself like, hey, it's gonna be a good day. I hope there's nothing too wild up or anything. Do you ever sit there before your patient comes and get to work?
Yes. So you do talk to yourself. I'm one of those people. I try to look at the glass half full. I try to be positive. Like I said, I had a conversation with myself years ago, saying, "Look, if you're gonna do this, you need to enjoy it. Make the best of it." And I did. And a lot of my peers are like that as well. And it feels good too when you have a person who comes in and they haven't had a cleaning in like 10 years, and you clean their teeth and their mouth is so much healthier, they're brighter, and that person feels so good about themselves. And that feels good. That feels good to help someone have a better smile, because that's important. You need you want your mouth to be healthy every day, not only just for your health, but if you're going on a job interview or dealing with people, you want to just have a healthy mouth. And it makes me feel good to be a part of that.
So when you do you like do you ever like make sure that you got everything prepared before the patient comes and you didn't forget anything? Do you ever like do you ever forget sometime when you got everything like, oh man, I forgot this, I forgot that. You experience that sometimes?
Yes, yes, you do. But our office is very systematic, and so we have systems in place. Um, we have packets pre-made, and everyone has their duty, and so it flows really well.
Mm-hmm.
You actually can become a person that has OCD when you're dealing in dentistry, because everything is set in a certain way.
Right.
So, for example, first thing is you set your room up, make sure it's clean. That's important. Medical history, blood pressure, you have the patient pre-rinse, and that way it cuts down on the bacteria in the mouth before we work on you. We take x-rays if it's needed. So there is actually an order to things. You clean their teeth, floss, and then the doctor comes in for the exam if you're due for an exam. And then we give you a goodie bag, which patients, that's their favorite part. You get your toothbrush and floss and toothpaste, and we set your next appointment up. So we do have an order to things. So it's almost like we become a little OCD or systematic, but that's okay. It helps me and it helps the patient. But there are times when you just forget something. We're all human, and that's when you get your coworker to help you out, and you go from there.
So if any of the hygienists in the office have any like, I mean, I know they've been there for a long time, but do they ever give you any uh advice on anything that's you need to work on better, or what you need to work on in the future when future new patients come?
Yes, we have hygienists who are good at like taking X-rays, so they may, there's no pride. I'm quick to ask someone to help me take an X-ray or vice versa. Also, there's some hygienists that are better at doing certain techniques than others. That's just, I don't want to say better, maybe that's
Mm-hmm.
their strength.
Mm-hmm.
And so we're always learning from each other. And if we have a patient that one person is seeing and then the other person sees them next, we try to make good notes in the chart or on the schedule to give them a heads up. Like sometimes we'll have a patient who's in a wheelchair and you need more time for that. And so they'll make notes in the chart so that we can accommodate that patient and make sure they have a great experience.
I was just for that. How y'all manage that with people in the wheelchairs? How y'all manage doing their teeth in their wheelchairs?
Most of the time, we can transfer the patient to the chair. And a lot of the patients who are in wheelchairs
Mm-hmm.
have learned or gone to therapy where they learn how to transition from one seat to another. But you do have those patients who are not in a wheelchair, and that's when you have to just accommodate and adapt. And you have to stand up or just bend over and clean the teeth the best that you can. And that's when I was talking earlier about your back and your body having issues. When you
Mm-hmm.
have to do that a lot, it can take a toll on you. So that by the end of the night, you may have your massager out or your ibuprofen trying to take it so that to help you make it in the next day.
Do y'all actually do you ever leave the patient in the wheelchair, do you have to ask one of the doctor? I mean, Dr. Franco or Dr. Zimmerman to help the patient out of the wheelchair in the chair, or you just leave the patient in the wheelchair?
Most of the time, you can take the patient out of the wheelchair and they come with a caregiver, the
Okay.
person who brought them, and
Mm.
that person will help you get the patient in the chair from the wheelchair to the dental chair.
But
But there are cases
but
when you have to leave them in the wheelchair. And that's when it gets a little bit more challenging.
mm.
It depends on how big your room is, and you have to kind of stand up and be in an awkward position. But it doesn't last that long, and you kind of get to it and get them out, get them, and do the best you can.
Was it hard for you to do that? Any hygienist, was it hard for any hygienist for to leave the patient in the wheelchair or transfer the patient in the dental chair? Was it hard for y'all to do it?
It could, yes, it's a challenge to clean a patient's teeth who's in a wheelchair because you're not in your normal sitting position. Well, as hygienists, I don't know if you remember, we kind of sit in a chair beside you and we lean over and you're leaning flat
Right,
on your back. But when
right.
you have someone in a wheelchair who's sitting straight up, you're not able as a hygienist to
Oh,
bend over. So you may
okay.
not be able to see as well. Um, so
So
yeah,
what
it is definitely a challenge.
when the person is like facing this way and they cannot move their they can't move their head back or anything.
Mhm.
How y'all manage to do that?
We bend over like this.
Well, okay, that's uh,
Yes. We
okay.
do the best we can. Yes. Yeah, we have to accommodate. We kind of like have to bend over more and just reposition. Um,
They'll take
and you can't,
they'll take
yeah.
you they'll take off they'll take two of y'all. They'll take how many people had to deal with the wheelchairs? Just,
Well, if you when you're moving the patient, it may take two people, two or three.
mhm,
But when you're working on the patient, only the hygienist can be working. But sometimes an assistant may need to use the it's something. It's a suction that helps suck out the saliva or the spit, and
mhm.
so you may need someone to help you with that. But in general, it's just the hygienist.
You
Now, with
get to,
Dr. Frankel, he works with an assistant, but it's a little different. In hygiene, we're
okay,
cleaning teeth.
okay.
Dr. Frankel needs an assistant to help him. And so the two of them work together to work on that patient. Mhm.
So if y'all get when y'all get done checking the teeth, all that taking pictures and all that stuff. So when Dr. Franco or Dr. Superman comes, how often does he like actually make sure that teeth are good and make sure there's no cavities or anything? I know that's often that's true, but do he actually like make sure the teeth is completely straight?
Well, the beauty of people working there a long time, Dr. Frankel doesn't have to, he has more confidence in us because we've been practicing 20 years, 30 years, 15 years. So he's been working with us long enough to trust that we will get the teeth clean. He's more focused on the decay part to see if
Okay.
they have cavities. Now, we, the hygienist, we focused on your gum health. And we also look at the teeth too. It's like a check and balance.
Mhm.
Sometimes, what I don't see, he may see, or what he doesn't see, I may see, because we're
Mhm.
actually in the room with you longer than the dentist. So we're in there 30 minutes to 40 minutes, and he's in there 5 minutes. And so it's like a check and balance, which I think is great.
So if the patient, let's say this, if the patient get there around like 11 o'clock schedule,
Okay.
and then the patient don't show up until about 11:30, 11:30, 11:35, do you still take them?
It depends. So we do have a 15-minute grace period because it's understandable. Sometimes traffic, the patient can't control it.
Mhm,
But usually 30 minutes. If we don't have a patient after you, or if you're easy cleaning and you don't need x-rays, we may see you. But we
mhm.
have to remember that there's a patient after you who comes there on time. So yeah, that's what give hygienists and dentists gray hair, is that your patient gets there late and you're trying to provide a service in a certain amount of time. So yes.
So
We prefer you be there early, 10 minutes early, but we understand if you, I
what's the
mean, there's a grace period.
what's the earliest that you had to see the person? Do you have to be at the doctor dentist at the after that time, or you have to be there like 5, 10 minutes early?
So our first patient is at 7:30. If you're a new patient or if you have a change to your insurance or
Mhm.
medical history, we do recommend you getting there about 10 to 15 minutes before your appointment time. But if you're a regular patient like yourself, you can get there at the time of your appointment. So, for example, if your appointment is at 7:30, you can get there at 7:30. But if you know that you have new insurance and you got some stuff to update, then get there early. Especially new patients, we do ask them to get there about 15 minutes early.
So, have you noticed when a patient comes and when they actually smile? I noticed like what does when people have like yellow teeth? What that actually mean? What people have like yellow teeth? Did it
It can
does it mean actually that you didn't brush your teeth at all? What that actually mean?
So yellow teeth could be that they need to be cleaned, or it's just the natural color of your teeth,
Hmm.
or you're eating something that is causing a stain on your teeth. There are some toothpaste that can cause staining on your teeth as well. But the good thing is when you go to the dentist, usually we can figure out what's causing the yellow teeth. And
Hmm.
if it's just your natural teeth and you've had a cleaning and your teeth are still yellow, then you can whiten your teeth. There are whitening options to make your teeth brighter.
Hmm.
As you get older, your teeth naturally get yellow anyway. So if you can drink water all day long, and as you get older, your teeth will naturally just get you know, yellow or dingy looking. And so not everyone has to do it. It's just a personal, thing.
Hmm.
Um, then you can ask your dentist about whitening to see if you're a candidate for whitening.
Oh, so I know I get it sometimes, but does it prefer brushing your teeth like if your teeth let me put it this way. I get this a lot. I look in the mirror sometime and I see my teeth yellow, and then when I brush them like twice, and it's still yellow. Wait, what the option can you do if you already brush your teeth twice and they try to get it done? What the best? What's the next best option? The person if the teeth are still yellow.
Talk to your dentist about maybe doing some whitening, or maybe if you're not using an electric toothbrushes help with the surface staining of your teeth.
Mm-hmm.
Sometimes the yellow comes from drinking coffee or tea, and even though you brush at home, it doesn't come off. We can get it off, but you only see us twice a year. Some people see us more than that, but the regular, normal patient who has healthy gums, they see us twice a year. Um, but yes, talking to your dentist about options to see what's causing the yellowing. Is it you're not cleaning your teeth at home well, or your habits, you're drinking or eating something that's causing the yellowing, or it's just natural, like your teeth are just getting yellow. But you have options. You can use your electric toothbrush. You can use a whitening toothpaste. They don't whiten your teeth. They just help with surface staining. So if you really want to get your teeth whiter,
Mm-hmm.
you would need to get professional whitening with a dentist.
So what the do you ever let me put it this way. When y'all get done with your shift
Mhm.
and y'all get together and y'all talk about what y'all did today. What are they most positive patients or you just are they like between are they positive are they positive patients or negative patients are they or between after y'all get done with your shift and everything and y'all come together and talk about what y'all done today.
To be honest, it don't even have to be the end of the shift, Jared. If a patient comes in there just being really rude or crazy, we're gonna talk about it in between patients, just
Mhm.
so that we can kind of get it off our chest and reset ourselves. But in our practice, most of our patients are really nice. I mean, you have patients when they remember your birthday, they come in with a good energy. They bring you things like some of our patients would bring us desserts and snacks and
Oh,
flowers and you have those kind of patients that send us cards and are really, really nice. And I would say a small percentage are just the ones where you're like, okay, this is helping me learn patience and work on myself.
right,
And you just got to stay professional and don't take it personal. Because
right.
again, it could be fear. It could be that they had a bad, usually a patient has had a bad experience in the
Mm-hmm.
past. And once they have that bad experience, they carry that on for a long time. But once you build trust with the patient and they start seeing us and building that trust, then the patient kind of changes. They may have a certain hygienist they like to work with, but they kind of get open minded and become better patients.
So do they ever tell you what? I don't know how I'm gonna say it, but do they ever tell you talk to? Do they ever like get it off your chest, off their chest, and tell you why they why they having um bad experiences when it comes to doctors or dentists like that?
Yes, there are some patients once you get to know they trust start build trust, or even in the beginning some patients will let you know, hey, look, when I was a kid, I just had a fear of dentists. You know, I had to get I had a cavities filled, and at a young age they had to get numb,
Mm-hmm.
and that's and they carried that with them as an adult, and so they have more anxiety when they come to the dentist.
Mm-hmm.
So you do have those patients, and they'll let you know, and that helps. So if anyone in your audience, or if they have a dental anxiety, let your dental hygienist and dentist know, because there are things we can do to help you with that. Sometimes we can prescribe some medicine that'll help you with your anxiety. Of course, you will need a driver for that. There are so many options. When we know that, we practice in a way where we're more gentle and we'll take care of you. So it's important to let the dental hygienist or the dentist know. Even some patients that call the office and say, hey, I have dental anxiety. And that's a good thing because we can prepare ahead of time. We may give you a little bit more time on the schedule. And so it helps us to help you. So don't hold it in. Let the dentist and the dental hygienist know that you've had a bad experience or you just don't like it. Some people don't like, I mean, we're scraping, we're cleaning your teeth. And so some people just don't like that sensation or that feeling of us cleaning their teeth. And there are things we can do with that. We can give you a topical gel on your gums to help with the sensitivity. Or sometimes we'll numb patients up to help with the sensitivity. Or we may not spray the cold water directly on your teeth. Or we may give you a desensitizing toothpaste to help with your sensitivity.
So when and the good you don't have there's no other job that you love to do. I know you've been there 25 years. I know that. But if I know what I don't put why is the pharmacy not a good fit for you? Why is the pharmacy not good for you? I thought I mean what
Organic
pharmacy
chemistry. Well, when I was in school, I took organic chemistry, and
mm,
I was like, I was an A/B student, mostly A's. And when I took organic chemistry, I guess I was in a place where I wasn't ready for that.
uh-huh.
I was like, oh boy, this is different right here. But actually, I also at one point considered being a doctor, but I felt like if I lost patience, that would take a toll on me over time. I
Right.
just knew that it would affect me emotionally. Excuse me. But with dental hygiene, I can still provide that patient care, and it still allows me to work close with the patient and still be in the healthcare profession.
If you, would it be? I don't know. Put it what would there a put it what kind of what would the doctor kind of was the doctor position, was it hard for you to do it, or were you just it wasn't good for you?
I think with me, I felt like at the time my mindset was that, let's just say I'm treating a patient like surgically or in a procedure, and if I lose that patient, it's out of my control.
Mm-hmm.
I would still take it personal. Even with our patients now in dentistry, we have patients we've been seeing a long time, and
Mm-hmm.
whenever we lose a patient from natural causes or accidents or what have you, it really affects us because
Mm-hmm.
we've been seeing that patient for a while, and it just affects you emotionally because you bonded with that patient.
Right.
And so, and being a doctor, I felt like I would have had more of that and just wouldn't have been able to cope with that. So dental hygiene is something I chose.
It is. Is it because the hours or the long hours they you have, or was it the space that you didn't like? Was it the long hours? I know being in the hospital it's gonna be long hours, but is it for you? Is it the hours or what?
Yes,
What?
the hours was a factor too, because a lot of doctors, especially in the emergency rooms, emergency room doctors, they do work some long hours. Um, but yes, the main issue though for me is the fact that I just felt like I would have gotten attached to the patient, and if I lost the patient, it would have
Um.
taken a toll on me.
Okay.
So I'm
Hey,
sensitive.
so when you came to when you came to the medical field, who was the first person that agreed you and become and you learn from then to now? Who was the first person that you met before you where you at now? And
um, the girls in my class were really, we bonded with them, and so once we went through the dental hygiene program together, we
mhm,
kind of stayed connected with each other because we were new to dental hygiene. And so one of my classmates actually helped me get a job in Atlanta. She was working in the office, and she recommended that I work at that office as well because they were looking for a hygienist.
mhm,
And so, dentistry is actually, people think it's big, but it's a small community. And you gotta treat people the way you want to be treated, as I said earlier in the
mhm,
interview,
mhm.
because it's a small community, and word gets around if you're not a good person to work with, or even if you're a great person to work with. So
So last question before we leave out of here. I know you got work tomorrow morning for your next patient and everything, but I don't think you see me. But you must see me in about in September when I'm turning a year older. So, but what kind of advice you gonna give to people who want to be a doctor? I mean, a hygienist, future hygienist, and they want to learn from you and the girls, and they want to get some tips from y'all. What kind of advice you want to give them?
my advice, if you want to become a dental hygienist, is to go to a dental office. Just call a local dentist or your own dentist and let them know that, hey, I'm interested in becoming a dental hygienist or a dental assistant. And a lot of places are very open to you coming in and just watching or shadowing the process of what it's like to be a dental hygienist. So
So
that's my advice. Yes.
you had to come. What you had to come in suits or like how they come in. Put it like how they come in the like we're doing interview. what kind of what the dress code for if you want to do that if you want to do that job?
You can come in your casual clothes. A lot of times, if a jacket is needed, we will provide that for you. But you can come in your casual clothes. Some people may come in scrubs, but you don't have to do that. You can just come in your regular clothes, especially if you're not working and you're just shadowing. Um, and we'll take care of the rest. Yeah.
So do they give you? I know you say you schedule your, your own schedule, but when they start their schedule, I mean when they start doing their own start off, do you make sure do they ask you questions about do they ask you questions about um what to do, how to like make sure that like if someone have like cavity the condition of bound teeth like mine, what the proper way that if you can't get the bound teeth and it my if the patient is like um if, what the good what's the good way to say it? What's the
Yeah, yes, so we do give you techniques and that you can use on patients because some patients, when you're working in their mouth, it may be sensitive, so they'll like tighten the lower lip. You can use a cotton ball to put down, I mean, a cotton roll to put in the inner lip to help you work in that area, or you can use your mirror. But yes, we do give the hygienist pointers on what to do, but you'll learn that stuff in school too. So when you're in school, you'll practice on patients or each other. You do practice on each other in school, and so that's when you learn about all those techniques.
I was there for the, when you when you taught like that in school where you came to hygiene now.
Yes, because we actually saw when I was in school, we saw you had a patients to see toward it was called clinical.
Mm,
And so you did have to get patients to come in, and you had to have so many patients to that was the stressful thing is you had to have so many patients to
mm.
graduate. And that's where you got a lot of your experience in. But you know what, Jared, it just takes time too. It just, some you just do the best you can and you learn from each other and it just takes time.
Well, I was in that on that note. Thank you for coming on my channel. Thank you for letting me know. Thank you for taking time off your busy schedule for coming on my channel and know about the dentist hygienist and all that kind of stuff. And I will definitely see you soon.
Yes.
And I will look. I don't like when I come to the doctor. I want to talk to Doctor Michael.
Okay.
If he's up for one, I'm putting him on the list. So, but
Well, next
thank you for
time you
coming.
come in, we'll ask him. And I
But
just
so
have one thing left to say.
go
Remember,
ahead.
everyone, floss the teeth you want to keep. Only floss the ones you want to keep.
Thank you for after that. That's great. That's a great to end it. But thank you for coming up here and showing me some love to my channel. And I'm glad you support my channel. I know you have not watched my channels in a while, but I'm happy for you to come up here and show your um love to my channel and everything. So I'll see you soon. I'll see you soon, and I will definitely talk to you about the point of everything. So thank you. I love you. I'll see you soon. Have a wonderful
Thank
night.
you.
But yeah, but I'll see you later. Uh, well, well, let go. But yeah, that's my dentist hygienist, y'all. I appreciate for her to take the time off to get on my channel. I know she mentioned it today. That's why I wasn't rushing. So I wasn't rushing everything. So today we're gonna do we're doing two today, y'all. We're doing two today. I'm definitely trying to get Shine day today. So I'm gonna sit here for a while and until Shine. I'm about to get him up here about 7:45 tonight. So if he comes tonight at 7:45 to 8 o'clock tonight, we're gonna get him out the way. I will have my teacher on Wednesday morning. On Wednesday morning, tip thing, make sure he don't have no meeting or anything. So you will have to see my teacher on Wednesday morning, 10:15 before you go to school. I mean he's in school, but I'm gonna tell him make sure he don't get caught with anything. So other than that, we're gonna wait till about 7:45 tonight. We're gonna get Shine Dig up. But I just about to send him an email again. I'm gonna send him the link tonight. 7:45 tonight. And then after that, it's gonna be um live all week. I don't know about the rain or anything for Thursday and Friday, but we'll see. But I see y'all tonight. I see y'all in about like few minutes. And when it hits 7:45, I'm coming right back in here, and we're gonna talk to Shine Dig. All right, I see y'all 7:45. All right, that's all right.